So, for today's episode, we have the honor of introducing Dr. Abhinav Singla as our first guest speaker. And from an undergrad at the University of Toronto to obtaining his MD at Poznan University, he's also currently doing his General Internal Medicine Fellowship at Mayo Clinic in Rochester, Minnesota. So, thank you so much, Dr. Singla, for taking the time to speak with us.
My pleasure.
All right. So, first thing is first, you attended med school at Poland. We're just curious as to why you chose Poland to do med school there.
Absolutely. So being an immigrant, when I moved to Toronto, I was 18 years old and I did my undergrad there. It was, getting into med school in Canada or North America for that sake, you need to start your preparations ahead of time. I'm talking about high school, have a portfolio, do enough volunteer work. And I didn't know I was going to be a doctor or a medical doctor per se, because I was more interested in doing research work. So 2 years into my undergrad, I realized that, when I was doing my co-op in a research institute, that I needed more than just being a research coordinator or a research coordinator assistant, just more knowledge per se. And I realized that the principal investigators I was working with had a better understanding of the project just because they have experience with patients. That's when I decided to go with med school. Yeah, right. So and it just kind of went from there. I mean, I was sitting in a lab. I remember this, and I was having a conversation with my friends, and they was like, "Oh well, there's a school in Poland which is interviewing right now," and this is right around, I would say, end of third year. To be honest, like I was thinking of giving MCATs and then maybe doing masters and trying to build up my resume, like all of you guys probably are trying to do, right?
Mm-hmm.
So, but he told me that this school doesn't really have a very stringent criteria, and most of the offshore schools are like that. And they had a good reputation in the sense that they had some providers, or their own students would become providers in North America. So I was like, you know what? I just kind of did a little bit of digging, applied for it, and it was one of the cheapest schools. And I'm not going to lie about that. That's one of the bigger factors, being new to the country, not having credit history, parents struggling, and you just, financially, you're not that in shape to go to, other offshore schools. I'm talking about, these Caribbean islands and all that stuff. They're expensive. $50,000-$60,000 a year is quite a bit, and I couldn't afford that. So Poznan kind of happened that way. It was a very spontaneous decision.
Mm-hmm. And I know that you didn't do the MCAT, correct?
That's right.
Did you ever regret doing the MCAT, or felt like you were the odd one out of not doing it?
Very good question, actually. I would agree that I did feel eventually that MCAT would have given me a scale to compare to where I stand when it comes to giving exams, because basically MCAT, it tests your problem solving skills, your, how do you handle a pressure, or how can write an exam and stuff like that. I wish I had exposed myself to it just for the sake of it. And the other two friends who went with me to Poland, they actually had done MCAT before me because they were planning to apply to other schools too. I would agree. I think I do feel that part is lacking. I wish I could go back and do that.
Yeah, because it is standardized test and all.
Right.
It is pretty intimidating, at least from what my experience was from writing it. But I was just curious as to you haven't wrote it, so maybe you may have felt left out on not writing it.
Yeah, no, and one thing I would mention here is, from my experience, from what I've heard from all the younger generation who's getting into medicine, I think 99% of schools, even if they're offshore, mm-hmm. or they do require you to have MCAT. So things have changed for sure.
Yeah.
In fact, I would actually doubt the credibility of a school if they don't require MCAT. So that was one of the big things which came up when I was in the interview. And they had recently started their English program and they were trying to develop it more. But even that school now, the one I went through, they actually require MCAT scores.
Okay.
Yeah. So just to follow up on that, actually, so you know how currently you're at Mayo right now?
Right. So
they didn't require you to submit any kind of MCAT scores while you were applying for this position here, or was it waived?
So MCAT follows you till you get into med school, and that's it. Once you are passed in the med school, no one will care about your MCAT scores or MCAT. Even if you've done MCAT, it's not part of your resume. It's not part of your any applications for residency, fellowships, or even jobs and stuff, whatever may be the case. So it's just a standardized test to just get into med school. It would be nice if they would use that as a scale, but there's so many tests you do eventually. For example, when I get into med school, after that, you probably know about licensing exams. Canada has a ton of them.
Yeah.
US has a lot of them. Anywhere you go, there are licensing exams, and those themselves are so hard, and they scale you so well that I don't think MCAT would stand any credibility against that. Even if you had good MCAT scores and you didn't do great in your licensing exams, and no one's like, okay, well, you were a genius back then. What happened now, right? So yes. So to answer your question in summary, I would say that it just only helps to go to med school. So my Mayo Clinic fellowship, since you had that question, it's interesting. So what I've learned over time is as your career progresses, the chances of you getting into the field you want to increase due to a few reasons. One is that you know the system, you understand what you need to do, you're used to working hard, and your exam taking skills are good. So the fellowship itself, most of the people who do fellowship at Mayo or other places, what they have is they have a plan in place, right? So there's a 6-year plan. They're like, okay, I'm going to do residency in internal medicine. I want to be a cardiologist. I want to be a pulmonologist. I want to be this or that. So they start working on it ahead of time. So first year residency, you're just learning the skills to be a doctor, which is internship. And then second and third year is when you're senior resident, is when you're writing papers, you're doing research, you're exposing yourself to the field you want to go into. If you want to be a cardiologist, pulmonologist, then you kind of keep working to expose yourself, building network, and trying to understand where you want to be. For example, if someone goes into a normal community hospital residency and they want to go into Harvard, those are some standards it's hard to meet in 2 years, unless, I'm being honest, unless you know someone or you have done such amazing work in your undergrad or you've done PhD before that you are a lucrative candidate for them, right? To reach that point, I would say, it's ambitious goal, but it's not that it's not achievable. It's just going to take more time. So by the time you get into med school, you start learning that the more time you spend in trying to get somewhere, the higher the chances are. And it's not like, before you get into med school where there's a time crunch. You have to finish your undergrad, you have to make sure your GPA stays up, you have to make sure you have volunteer work in there, you have publications. And if you do it in time, that's when medical school is like, yeah, this is a good candidate. After med school and, when you're in residency, people realize that life happens. And then if you want to go into something else, then you just keep spending your energy into it. For me, Mayo Clinic happened, to be honest, I always wanted to be an internist. I did not think myself doing the specialization. This happened because, like every brown person on this planet, I thought I was going to be a cardiologist or a gastroenterologist because, those are the competitive fields. But I did few rotations during my medical school and during the time when I was doing residency in gastroenterology and cardiology, and I got bored very easily. And the reason why I'm saying is because the patients have minimal diagnostic requirements rather than they're more focused on the treatment and procedure options. A lot of people who do fellowships because they do it because it's more focused in one thing, and it gets repetitive, and that got me bored. And that's where I actually ended up doing the job. As you guys know, that after my residency, I did 3-4 years of internal medicine inpatient hospitalist work in on the West Coast. And that was the time when I wanted to first, sharpen my skills as a physician. Also, I wanted to see what I eventually would like. I knew that I wanted to be a researcher, and this goes back to when I did my undergrad. But then getting to Mayo, it happened, to be honest, it was very spontaneous again. So what happened was after 4 years of my finishing my work, I was going through places to apply for a job. And for some reason, I had a mail from Mayo in my junk box. Actually, they do recruitment that, we are looking for physicians. So what you do is you put your resume up from whatever achievements you've done on LinkedIn and all those other places, and they pick people and they just send emails. So this is a mass email, not specific to me. And I just applied for the job there, and I interviewed almost 6 months with them for the job, for an internal medicine job, but realizing that first of all, I'm not part of the network. Secondly, I did not come off an academic institute before that. and my resume was not up to their standards, etc., etc. So, being persistent is what got me here. So I reached out to the one of the people who interviewed me. I sent them a mail separately saying that, hey, I really want to be at Mayo because I love the ideology. And again, this happened during my interviews during the job, that they actually, talked about how Mayo Clinic works and how their ideologies, how it's very patient focused and stuff. So I felt the energy was good, and this is what I wanted to do, and that made me even more motivated to be here. So you got to understand, like, this is a huge salary cut for me. So I dropped. I'm basically earning literally, a fraction of what I was making before. So a lot of people don't go from job to going to fellowship, but being focused, and I wanted to be, in a place where I can be satisfied. It's when persistence came in. I asked them, like, what do I need to do? How can I make it work? And they told me that I knew about it, but they told me, like, you're doing the General Internal Medicine Fellowship, which will sharpen your research skills and you can get exposed to your environment. And if you do well, there can be an option depending on job availability. So that's how I ended up in fellowship in Mayo. Everything is by chance. Like, sometimes things happen just because they're meant to be.
Yeah, no, I'm glad that you were able to tell us in detail what happened for you in terms of your experience. So thank you for letting us know on that.
Good thing for the junk box, right?
You will be surprised, and this is amazing because you will be very surprised how many times things land in junk box. Like, I was reading a mail I not checked I tried to, but there was a mail I had one of the journals who had read one of the research articles I've written before, and they were like, hey, we have something that we want you to write on the same lines of what you've written before. But the deadline had passed because they wanted me to submit for, certain issue, certain month or something like that. So I wish I knew about it earlier, that I could have just written something, because I've already done the work. It would be helpful to get that published too. So yes, please do check your junk box all the time.
I find it kind of hilarious, but at the same time, it's like, that theme of like, if it's fate, it's going to happen.
It is. And interestingly, all my life, to be honest, you'll see people who tell you that, hey, be persistent, focus on goals, try to reach somewhere or have a goal ahead of your time. I don't know a single successful person in my surrounding. I'm not talking about people who are legends, like, I don't know, like, I'm talking about Jeff Bezos or whoever. They have sat in their garage of this vision. I can't think past the next month. Like, sometimes it's like, you know what you're good at, what you can do, but knowing that, okay, I'm going to make Amazon in 20 years is not the feature I have, and not other people have known. They said, this is interesting because my mentor, who's been in Mayo for a long time, I'm talking about 30 plus years, he said, if you look at my first few articles, like, he's probably like 200, 300 publications. He said, like, my first 10 articles, if you look at it, Abhinav, you'll see that they're all over the place. And that's when you learn the skill. But eventually you decide what you want to do is based on that scale, and that then you find your passion. I don't know. I don't want to demoralize anyone saying that, hey, if you have a passion, don't follow it. But sometimes those passions are not driven by right motivation. And the reason why I'm saying it is because, okay, no, who in the world doesn't want to be rich and famous, right? There are some people who probably don't like it, but I'm just saying, like, you want to have money. So if everyone just kept focusing on, hey, I want to make money, I want to get there, then every other person would be Jeff Bezos. If it was all based on the fact that, persistent and being hardworking. So there is a lot of role of destiny and luck in what people achieve too. So if you don't find yourself in a position where whatever you're trying to achieve is not actually going in a direction, but there's another golden opportunity which has come across you, I would take that opportunity over the fact that I had a dream one day that I'm going to be Jeff Bezos. Does that make sense at all?
Mm-hmm. Yeah. I think, like, since we're on the same topic about like passion, I know that everyone, like, especially us, like, being an undergrad, we've like experienced some sort of like setbacks and failures at a point in our life. Is there like any setbacks that you've experienced, perhaps like from your undergrad or as of your career right now, that you were glad that happened, or that you wished would have gone the way that you hoped it would have gone?
I would say every other day. It seems like, failures sit right next to your successes. And For me, they have been the driving force. And I'll tell you a little bit on my story. And I think I mentioned in that PowerPoint we did too, that, I, coming from families, ambitious parents and all that stuff, I wanted to get into IIT, which is the Indian Institute of Technology when I was in India, which is one of the reputable engineering colleges or, chain of colleges, right? And I thought, working hard and just, focusing on trying to get there is going to be good enough. And I remember I went to coaching and all this stuff. And mind you, in my primary, secondary school, mathematics was not my strongest skill. Like I was weak at it. Not in the sense, you would get nervous in exams and I would mess up some formula and I would just get stuck on one spot and not move forward. But, I thought that was my failure and I need to come over it. That was my fear. I need to get over it and I'll fight it. And that's what I went 2 years of preparation for IIT. Forget about getting into IIT. Like I couldn't even pass a screening exam, which is the first thing they do. And it shouldn't be that hard for someone who's focusing to be getting into IIT. And forget about that. Even if for engineering college, my rank was really low. And it wasn't a shock because I knew that when I was preparing for this exam, I was like, hey, I don't understand a lot of them. My physics was strong, but everything else was like, it was not setting right. And then opportunity happened. I came to Canada by chance. My parents immigrated around the same time. And I remember walking to University of Toronto office administration and I applied for engineering, and they was like, hey, you're coming in June. There's nothing else available, but your scores are good except your mathematics. But what we can do is we can give you molecular biology for the first year. All the basic courses are the same. And you can transfer over to engineering after that. And, taking that, as I said, an opportunity, I just took it and never looked back. I mean, first year I did molecular biology. My GPA was, through the roof. I was very happy about it. And second year, went well. And third year I took molecular biology course, which was the lab course. I don't know if you guys know about it. It's pretty extensive and I almost failed it. So, you know what I mean? So it's just, it keeps this cycle of failure and successes will always be, it shouldn't determine how your life is going to go, for sure. Like those setbacks should not determine where your life will go. But the goals you determine yourself is the lessons you learn from those failures. For example, now let's say if I was stubborn, after first year, I was like, okay, you know what? Forget it. I'm just going to do engineering. That's my goal because I love it. Even though I don't know anything about engineering and my mathematics, I would be just an average engineer. I would be below average engineer. I would be really bad engineer, I think, if that was the case. But, I saw that my biology scores were good and I liked it, that it was a skill I possessed that I was like, you know what, maybe I should keep going in this. Does that answer your question that, about the setbacks, that how they play a role into your life?
Yeah. Sure.
I just want to say that I really appreciate the no filter kind of thing going on right now. Because I think when people think about the journey of becoming a doctor and even beyond, they have this perfect picture, someone with straight A's and then they got in awesome MCAT and they just get in and then they're killing it in the residency. No one really talks about all this kind of stuff. So I really appreciate this whole conversation.
Oh no, you're welcome. And to be honest, this is exactly what I felt too. When I would I remember being in Canada and trying to make a network and trying to talk to people who were already physicians and, through family, friends and stuff. I would never get a straight answer. I would ask them questions like, hey, tell me, just coach me or tell me just few things. What do I need to do now to get into med school? Oh, you'll do fine. Just get a good GPA. Do some volunteer work. I mean, what does that mean? I mean, it's not a concrete, specific answer. I used to get that all the time, and it was very frustrating. And I was really surprised there are a lot of people out there who actually became, successful physicians just with that straight A setup, having that straight A path. But I don't think if ever I got an opportunity and people or someone asked me oh, if you were to go back in time and you were to do your journey again, but this time you'll get everything exactly how it's supposed to be, I would say no to it, because everything I did to get here, and in all honesty, I'll tell you, I'm not. Don't put me in pedestal at all, because I don't want you to idolize the fact that my journey was so twisty. The point is that it's not going to be same for everyone, and I don't think people should give up on certain their dreams as long as they know their own value in that dream based on what other perfect people tell you. And I'll be honest, like every time I had a setback in my life, for example, so after second year of your medical school, you're supposed to do your USMLE step one. And I could not give that USMLE step one for some reasons, personal reasons. And I had to go into third year without a USMLE step one. And, school doesn't look at it as in a good way. It's like, okay, well, you're kind of falling behind. I was like, no, I want to be fully prepared when I give the exam. And even though there was a setback, I knew exactly what I need to do to get a score which will get me into residency. So that was my plan. I made adjustments with the fact that, okay, school is not going to like that. But at the same time, I wanted to get to a point where I wanted to get into residency. So I spent extra time studying for that step one. And I got a score where I got the scholarship from school for getting such a high score. I'm trying to, toot my own horn. It's just, I feel like you should be so in touch with yourself of your skills, and when you're ready to hit it, it'll go right for you at that time.
Yeah, no, that's pretty amazing, like your whole journey for sure. Despite all the setbacks, I really think that the whole picture turned out pretty well. So, and I know everyone's journey is not going to be the same, but this really does give us an outlook on having different paths. Like there's not always one path. So right. I feel like this will definitely help people in that sense.
Good.
Yeah, like especially like you coming as an international student, not following a traditional path really shows that there is like, you are basically living proof that we could go through a non-traditional path and still make it to where we want to go.
And you should. And I think people should stop going into conventional paths. For example, and UFT is a great school, and you learn a lot of things here. But I also wanted to say to people who don't get into University of Toronto, I have known people who've gone to York or whatever, and they have become gastroenterologists eventually. It's not like it's a determination of, hey, you didn't go to University of Toronto, and that's why you're not worth it. Or someone who doesn't go to Harvard is not as good of a doctor, or someone who went to Harvard. And honestly, it makes you a stronger person when it comes to your character, when you don't follow people's path and you just kind of make your own. And most successful people do have that kind of story, right? Like they just happen to be in place. For example, I recently read, and I don't know if it's true or not, in Microsoft, right? So when he was in high school or something in Pacific Northwest in Washington State, and he and his friend who started in Microsoft, they were both in a school which happened to have some early computers in them. Like there were only 2 schools in the entire state, apparently, and cross-check those facts. But, I think that's what it was like, but there was chance which happened for them, and they were curious about computers, and now the journey took from there. I don't think they decided since their primary school was like, okay, you know what, I'm gonna make something in computers and I'll be successful in it. So live your life, if that makes sense, and let the opportunities come to you, and they will.
Yeah. In terms of I know a lot of us have been, with this whole pandemic, have been experiencing mental health has been a huge risk in terms of burnout. I know that burnout's a real issue with the job, especially in this field of medicine, and even with students pursuing especially pre-med and medicine programs. So is there any tips or advice that you would give to students who can help improve their mental health and prevent burnout?
So it's interesting that, I have not come across any solid articles about burnout in the sense that I can comment on that, what is exactly causing burnout in early. So what I meant to say was early in the school for med school or pre-meds. I'm just trying to understand the question a little bit, because there are different kinds of burnout. There is anxiety and burnout because you're in the field where you're working so hard and you can't control your hours and you're nonstop working, and that's causing burnout. Or the emotional stress from the job itself, or emotional stress of the fact that burnout because that you're not able to get anywhere even though you're working so hard. So just clarify me a little bit, from your experience, what kind of burnout are we talking about?
Yeah, burnout in terms of how your career as of right now, where you're working at.
I see.
I'm pretty sure you've probably have experienced burnout. I'm just curious as to how that had felt or impacted you in any way, or could you tell us a bit about your experience with burnout?
Sure, absolutely. So what I had experienced when I was working, so 2019 and 2020 starting is when pandemic kind of started taking the course, and by mid 2020s and late 2020s, we were a full blown pandemic. And that's when I was working as a hospitalist, internal medicine doc, and I had to cover ICU patients too. And obviously there's demand there. Our hours were long, and, wearing masks, not knowing, what the outcome is going to be. You're just jumping into fire, vaccination was not available. That did create some sort of mental distress that, hey, I don't know what this is going to lead to. But at the same time, I think it was an uncharted territory for a lot of people. And that kind of made it worse. So what I want to say was that, being a hospitalist, internal medicine doctor in ICU and, covering those patients, it did create that distress. And a lot of it is also, as I said, it was an uncharted territory and not knowing what to expect next. And that became a vicious cycle. And also, not having clear guidelines, not having a vaccination, and et cetera, et cetera, et cetera. That being said, I mean, it's hard to give a tip on something which I've experienced, but at the same time, I coped with as things came. For example, say that, okay, we didn't know what to do with the patients. There was this frustration that we are not getting clear guidelines, and what are we supposed to do with them? There's not enough evidence. So I kind of went with the flow. I mean, whatever the best you can. You just try to step back a little bit and look at your journey of becoming a physician, or in whichever situation you are in, and just realize that this is part of the process. This is part of your journey. This is why we become physicians, because we know that once in our lifetime, or many times in our lifetime, we're going to come across in situations where we're not going to know the answers. But using that knowledge to do better, and just focusing on the fact that this is a job. It's not your life. It's just a temporary phase. It is I think keeping that optimism up, I guess. That those are the things which help. You can't really control the circumstances. You cannot control what is decided at an institutional level or a country level or at the world level, because you're not in position to do that. So going with the flow, but keeping stress to minimum, talking to your family, having a good network where you kind of talk to each other. And the one thing which helped quite a bit is humor during COVID. Mm-hmm. I felt like, those memes and people just sending humor to each other was kind of a therapeutic thing where people would laugh it out. It's like, whatever. And also, having friends and folks who are in the same position, just kind of venting it out to them. Mm-hmm. Hey, like, my day was really bad. Like, this sucked. Like, and people did it. Like, Instagram and social media. I know a lot of people say that, virtual media has a lot of cons to it, in real life. But in real life, if you were to go to a job, how much time would you get to actually meet someone to vent it out? You know what I mean? Like, in social media, it's at least easier that you have WhatsApp groups and Instagram groups, and you just kind of send each other messages, and you hear someone else is like, oh, you're going through the same thing. So, someone else's pain is your remedy kind of thing. It's like, okay, you know what? Yes, I'm not the only one kind of thing. You know what I mean? Like, it's just, it's funny. I know it's funny, but at the same time, it kind of, it groups you, it puts you in that crowd where you feel like you're not alone.
Yeah, for sure. It does.
But, I'm just curious. You mentioned that you've never really had like a total kind of breakdown in terms of burnout. So would you say that's because you have like exceptional time managing skills, or is it like due to something else?
Yeah, no, if I think about it back, if you think back in time and try to think of one day when I felt like, crap, I can't take it anymore. I think I just literally smiled to myself. I felt like, I had like, I think 25 patients on my list, and half of them were new and 7 of them were COVID. And I remember I had to dress up multiple times to talk to these patients. I just smiled to myself like, listen, I signed up for this, and it's interesting how this is developing. It just turned into curiosity in the sense that how far you can push yourself. And I don't know, like it never, I never take my job as something which, makes me feel like, man, like what did I end up with? The only frustrating part which makes you doubt in what you do is when the problem comes with from institution level, like when you are not able to help people like you want to, you're not making much difference, and they're frustrated, you're frustrated, you're not able to answer your questions, and etc., etc. But I think humor and just kind of going with the flow, and I felt like, hey, it's just one day. I think tomorrow is going to be a better day. If not, then the day after tomorrow. And I love my job. That's another thing. Like, I always enjoyed helping people. And I'm not saying it in, very cheesy, stereotypical ways. Like, hey, I've went into medicine because I want to help people. I just enjoyed, I just do enjoy interacting with people, knowing their problems, what can I help them with, and to our knowledge. And if I don't know the answer, that turns into a burning desire to want to know the answer sometimes. I mean, not every time, because obviously, you're tired and you're like, okay, whatever. Let's have a specialist handle it. But if there are no answers, for example, in COVID, just curiosity. For example, recently we were just reading and thinking about, and there's data collected in Mayo already, like, connection of certain biomarkers or cytokine reactions to COVID or post-COVID syndrome, and these people have higher levels of those inflammatory markers. So just to answer those questions, like, no, post-COVID is real, and don't tell people that this is just your mind and you're just PTSD, etc., etc. There is a component of that too, but it does leave mark on people after they're done with COVID too. So yeah, just, to answer in a brief way, is that it just helps when you just focus on that this is job and you like what you're doing, that's it.
Yeah, like since you were talking about like you loving your job and all, like what's a typical day in your life?
Okay, so at 6:30, come in for morning rounds, talk to the residents, and get a list of patients I would have for the day. So you typically, the list would be from 18 to 25 patients, and you'll always have the 5 patients you're following, and then you'll have like 5, 6, sometimes 8 or 9 new patients on your list, and you just do a chart review. Sometimes the nurses will start paging you, asking you for very specific acute orders. For example, someone's crashing, then you have to obviously go see them right away. But most of the patients are stabilized by the night doc who admits those patients. So you go over your list, you look at the information, why are they there for? So it's a quick chart review. It takes about an hour and a half for 18, 25 patients. And you get into that skill once you get in a practice. And then you just go for rounds. And, depending on your list, how sick the patients are, you start from the sickest patients to all the way to the ones who are just waiting, for example, for a hip surgery and they need a pre-op eval or something like that. So I typically by 9, sometimes by 8:30, I would be on the floors. I would be seeing patients by 8:30 to 11:30, 12. I tend to finish my rounds, but sometimes if they go longer, then I'll spill the patients after lunch, the ones who are stable. And then while I'm seeing the patients from room to room, for example, if there's a patient who's admitted for sepsis, secondary to a pneumonia, after making sure their numbers are good, ordering labs, I would just put in the orders for the treatment, talk to nurses, move on to the next patient, etc., etc. So, and I would try to do my notes at the same time so I don't miss any information I've talked to the patients about, and the nurses have something to refer to. But, busy as it is, it's hard to sometimes complete the whole process. So I would sit from 1:30 to about 3 o'clock, 3:30, 4 p.m., just kind of finishing notes, tidying up stuff. And mind you, during the entire time, you can get multiple pages and someone can get sick during the time and you just kind of run to their room. You can get code blues, and someone's crashing, you have to do resuscitation. So those kind of things are atypical and they can happen, but a normal quiet day wouldn't have that in it. And by 4:30, you basically have wrapped up. And during the same time in the morning when you're done, you're seeing your patients, if you need to involve a consultant, for example, if someone's coming in with chest pain and they need a cardiac cath, you just call down the consultant at the same time. So you're multitasking at the same time, like, doing multiple things at the same time. And 4:35, you wrap up your day. And then sometimes you do what's called a safety rounds, and you go through, those rooms again, and those patients, just not talking to the patient, but the nurses, making sure that everything is squared away. So 6:30, you're done, and you head home for around 7. 7 is when your shift ends, and you're carrying the pager till 7 o'clock, and the night doc takes over. This is a typical inpatient day, and we usually work about 7-8 days in a row, and then we get like a few days off, like 5-6 days. Every hospital is different, and I know 5-6 days off seems quite a bit, but after 7-8 days of 12 to 14 hours of shift, believe it would take me about 2 to 3 days sometimes to recover from it. So that's how typical life look like as a hospitalist. And now, just to add on to that, sometimes, if someone's crashing at 6:30 and you're the on-call doc and you just go down to do resuscitation or get consultants involved. I've stayed at work till 11 p.m. or 12 a.m. and then come home, wake up at 5 o'clock and then go again for the next day. And if this happens on your first day, oh God, Jesus, then the 7-8 days are just, your sleep lag is just, it kind of goes with you. Yeah, that's the inpatient side. Any questions on that?
I'm just like, I know we were talking about this, like where you were saying that you don't teach residents anymore because you're now focusing on like clinical research, but like how was it teaching like residents? How was that experience? Was there like anyone that like got on your nerves or anything?
Oh yeah, no, inpatient side. So I was teaching residents before I joined the fellowship and being part of the faculty for that long. Teaching is, I would say it's a difficult task. I mean, it's sometimes it felt much more difficult than actually having patients. I mean, I could handle a super sick intubated patient and not, twitch even a bit, but having a medical student resident who doesn't kind of, follow your frequency can make you want to pull your hair out. It's just amazing. It's true, because you got to understand, everyone who reaches their career in that point, they have a lot of knowledge. They don't have enough experience. Yeah. So that mix sometimes can go either way. Sometimes they're super humble and they want to learn more. Sometimes they're super, confident and they don't understand that they can make serious mistakes. And it's a team. With residents, I would have one senior resident, 2 interns, 2 or 3 medical students. So it's a full 5-7 people team, and making sure no one is messing up. So it does take the load off me because they are doing some of the work, putting the orders. But you got to understand they're making mistakes every 3rd or 4th time. So you got to keep an eye on that. And we use preventative medicine to avoid things to happen. We don't want patients to be in ICU, but if those mistakes are not caught in time, they can be drastic. So they don't get in the nerve. I also enjoy teaching in the sense that I like shaping that ideal physician I have in mind. I don't think I have ever become that. I think I have a long way to go, but I would like to see it in someone. And when I get to try it on some really smart, intelligent students, then giving them that motivation. Hey, you know what? You got the curiosity going, you got the right aptitude, and but you just gotta push it a little bit in this direction. And when they pick it up and run with it, and you see a drastic difference between first year and second year, it's an amazing experience for sure. Yeah, but yeah, it can be challenging.
Yeah, like I know, like you said how you're like giving basically the tasks to the residents and med school students, but like in a way it is also a lot of work for you, just so that you're like checking up on what they have done, basically.
Yeah, and it's people's life, right? It's not like give them a lab assignment. Sometimes it's an inpatient medicine, especially, things happen in a matter of seconds sometimes. Like for example, I'll just give you a brief example. If let's say there are certain medications which are done by drips, some pressors, or these medications need to be put in specific orders so that the dosage is uniform. Now, if the resident confidently goes ahead and put in the order, but with a much higher dose or lower dose, you can really mess up someone's circulation. And from going from septic shock, from not having enough blood to your brain, you can cause them to have a heart attack or a stroke. There's a fine balance. I mean, I'm just exaggerating this, but I'm just saying, like, there's a lot of fine tuning. And so you have to, and mind you, it comes with experience. It's over time, that, okay, these are my 5-6 sick patients, and I need to be very closely looking at what residents are going to do. But then that someone's just waiting for a hip replacement, as I said, that there's not much to mess. And there's one thing I want to say here, and it's very important for people to know. Our nurses and our mid-level staff does not get enough credit. They do not get enough credit in medicine. They deserve much more than actually physicians, residents, or anyone who's reached that point, because they are our checkpoints, they are our eyes and ears. And a lot of times it happens, like, nurse will send me a message like, hey, your resident is telling me to do this because she has experience. She can say that. I don't think this is the right choice. Like, okay, yeah, you're absolutely right. No, that's not what we want to do. So kudos to all the nurses and mid-levels if they ever get to hear this. But I mean, they have been the ones who have faced this pandemic head on as compared to doctors, to be honest.
Yeah, no, thank you for like acknowledging them. That's very humble of you.
It's true. It's true. And I don't
Yeah.
think we talk enough of this. So yeah, no, that's been the teaching experience. And I if I get an opportunity again when I'm in position, I probably will continue doing it.
Mm-hmm. So now you're focusing on like research, correct?
Right. So the fellowship was kind of so-called an audition, let's say that. I felt like it. I did do clinical work as well. I was seeing complicated patients in Mayo in a general internal medicine side, and I did okay. I guess experience helped, but I also am focusing quite a bit on clinical research. Right now, my topic of research is related to fibromyalgia. For those who don't know, it's a disease which is not very well understood, relatively newly understood. It's related to central sensitization. Basically, what happens is your body feels pain everywhere, fatigue. There are other your sleep disturbances, sometimes depression, etc., etc. Fibromyalgia was initially coined as someone who would have pain in multiple focal points on your body, but over time it has been realized that it's just not the pain. There are other components to it too, and they can vary from person to person. Before it was thought it was a psychosomatic disorder, but in the last 10 to 20 years, a lot of progress has been made.
Shraddha, did you have anything else you wanted to say?
I just wanted to know what you have to say to everyone who say that doctors don't have a life. Do you agree with that, or do you think that that's a bit too exaggerated?
Now, it depends on how people define life. I will say that doctors do have a very good life if they know how to make that balance. So I'll give you an example. A very good friend of mine, he moved to Miami after finishing residency. He's an internal medicine doctor. Worked hard. He's got a nice house on the beach. He had look at his Instagram. He's meeting friends every other evening. He's got a boat. He's got time to go out on the boat. I mean, when he's working hard. When he's not, he's not. So it all depends, not having life. I mean, if you're a person who can only work from 9 to 5 and, and clock out, and that's when you think your life starts, then yes, yeah, being a physician definitely takes that away from you because you have to keep going. But if you feel like, hey, I can work hard today and tomorrow, day after tomorrow, but Saturday, Sunday is mine, and I'm going to plan this event, or I'm going to go for a conference, or I'm going to go for vacation, and I'm going to forget about everything, that's possible too. So in summary, I mean, hustle is everywhere. If you want to have a decent living, you want to have decent status, and I mean, hard work is everywhere. Going to take your time away from what is called quote unquote life, you know what I mean? But also, hey, there are introverts out there. There are people who become doctors because that's the only thing they want to do. So they put themselves into those situations. And you and me, we both know that this is hard work. And if you want, there is enough opportunity to keep doing that hard work. So I guess a lot of times we come across those people in our family, friends, or in general, that these are people who actually have put on a lot of work and they want to keep going. And that's what they like to do. So that's why when you look at them from outside, it's like, oh, he doesn't really have a life. He doesn't want to come out. He's busy, blah, blah, blah. But that's what he's doing. He enjoys his life that way. But there are physicians out there who still want to do everything else and just want to keep the other part of being a doctor not too busy on themselves. It's all up to you. Does that answer your question?
Yeah, it definitely does. I feel like it's really subjective. Like you said,
Right.
It depends. Like if they enjoy what they're doing, I don't think they'd feel like that. But
right.
Some people do tend to say that over time, people get exhausted, and then they do say that, they have certain regrets of not doing certain things, like when they were younger and stuff like that.
Right. So I think I should add that there is a lot of mental, emotional burden, and that is the burnout, I guess you guys started talking about, that you do carry with you the more you do medicine. And I guess that is where the whole thing becomes burdensome. I think if you think about it, if you have friends, you have 10 friends, and even 2 of them come to you on a regular basis and complain to you about everything that's wrong in their life, and you keep helping them through that, after a certain time, you'll be like, you know what? I'm blocking you. I'm done with you. There's nothing you can, contribute to me except the fact that you bring your complaints to the table. So think about a person on the other side of, this career where they have to listen to people's complaint in and out every day. And, they may be grateful, but a lot of times people are not these days, but it's just that burden you carry, it keeps adding on. And that's why one of my mentors, actually he's a program director too, I told him like, I think, and he's been working so hard, I'm like, I think you need a sabbatical. You just step away from everything, take a 6-7 months off. Someone else is gonna be able to fill the position, but fill the spot where they need to help patients, and then come back again, reset yourself. And yes, you're right. I think those people are not lying when they're saying that, yes, I wish I had done something else, because they think in any other job, it would not be as much emotional or mental burden, which is quite a bit true. But I think nowadays, anything you do, step into anything, it's stressful. Like, I feel bad for younger folks who have to find a thing to do in their life, but there's so much comparison, there's so much competition, there's no clarity of what can lead to what, and too many options. Like, it's a different game you have to play. So that can cause a lot of emotional stress too, I think.
Yeah, definitely. Just going through this right now, it's like very taxing emotionally, just because
Right.
like the effects are like already like here. Someone asks you to go do something and you have to deny it because you're studying for midterms or finals. Like
Right.
Everyone right now, they're like living it up, and then you're just here like in your room studying 24/7, which is not bad, but that FOMO, the fear of missing out, is always there. Like,
Right.
What if one day I look back and then I'm like, man, I should have went to that party or something like that,
So I'll tell you this, and I know I don't want to extend it. So you had a very good point you brought up, but also everything in small doses is good. So don't deny yourself all those pleasures, but you realize that even as a person who's studying for midterms, this is in a way fun too. I know it's hard to admit at this point, but sometimes I miss having that, kind of pressure where I am going through that, but then when I'm done with it, the relief from that pressure and actually enjoying something I want to do is much more. It just escalates more. So keeping those in small doses and alternating those things, your life is way more adventurous than anyone who's out there going on a boat or doing adventurous things or going to partying every day, because they're going to get bored much easier than you would. And that's why I feel like I used to think the same way. I'm like, I want to retire early. I want to just like make enough money and blah, blah, blah. Just live up life. But I go on a vacation after 2 weeks or 1 week, I'm done. Like I'm like, okay, that's enough. Like, I cannot take more of this sun. I cannot take more of this beach. There's only so much you can do. It's not fun anymore. So people who are ambitious, they tend to have this nice alternating sing-song kind of life. And believe me, it's way more fun. I personally feel it's way more fun than having a consistent fun stage or a consistent studying stage. So what you're doing right now, midterms, kill them, put your 100% in it, and then once you're done with it, live it up whenever you can.
I feel like that's like really good advice, because that's something I feel like most people struggle with in undergrad. They're always wondering like, what if they miss out on this chance or miss out on that chance? But I feel like you said, there should be a balance. So I think everyone's still finding that balance. I don't think there's like a time crunch to finding that balance. I feel like that will come naturally, but it's just this awkward phase right now where we're trying to find that balance,
Right.
I guess.
Right. Do you guys have coaches or mentors, or did you guys have that? You remember I mentioned it once that, I don't know if you have a program where someone who's experienced in the sense that they have gone through life, those things, and you can bounce ideas off them, or you can bounce even if your mental state, like, hey, I'm feeling like I'm giving 100% to this, but I feel like I'm always missing out on this. And they can just look at your overall journey, or like just looking at your scores and look at what your plan is and be like, hey, I think you're doing okay, or hey, no, you need to probably, go up on this and go down on this kind of thing. You know what I mean? Like, does that make sense? Having someone to coach you rather than just blindly, which probably 99% of UFT is doing right now anyways.
I mean, like, being in this field, it's like pretty competitive. So trying to find someone that is like a mentor you look up to is pretty challenging, at least in my case. I don't know about Shraddha's, but...
Right.
In terms of mentor, like being a brown person, many other doctors, right? And you can only ask like those people that are also like family friends or something. So then they also can't do that much just because things have changed from the time they've become a doctor to like now. All the protocols and regulations, everything has been updated. So they also have this different kind of like view on things, right? But then you can't really blame them for not being up to date with the system.
Right.
And then also like they give you the conventional feedback, like you said earlier, which is not their fault also. Like it's really like the matter of paving your own path at this point. Like you really can't go off of anyone as of now, just because there's so many ways to get to like A to B that you just have to figure it out on your own at this point.
No, you nailed it. And I think that's not frustrating yourself with the final, getting answers right away, and just kind of paving the path as it goes and focusing on what makes you happy. I know it's so cliche to say that, but it's also so true. Getting in touch with yourself. There's not enough money in the world. There's not enough fame in the world. There's not enough success in the world which can make one happy if they are not in touch with themselves and they don't know what actually makes them happy. You got to find little things. I'll give you a small example. I remember when I was studying for my steps, step 1 for USMLE, obviously so those 4 months or 3 months, whatever you get, they're the toughest because you have to study the entire medicine, and you have this good 8-hour exam with 300 some questions, and you have to literally be in the 90th percentile. And I was studying almost about 14 hours, 16 hours a day, every day. You can understand that there's so many your mind is going to get saturated. So what I was doing was I was basically I was studying for like 2 hours, and I would just play some small stupid series, like I don't know, that 70s show or Friends, or even idiotic shows, I don't know. I would just watch it for half an hour to brain myself, and I really enjoyed watching it because I felt like, okay, I'm gonna take this pleasure right now and I'm gonna move on to my next element or whatever I'm gonna study next, thinking that, hey, I'm gonna need to learn something new. So that zigzag pattern. So it's just a matter of taking those moments, I guess. Pave your own path, as you said.
Yeah, it took me a long time to realize that actually no one can get me to where I need to be. Like, it's really all just dependent on me and my own judgment. Because at the end of the day, advice can only get you so far. And I feel like you really have to rely on your own judgment and your own like confidence in yourself. Also, you have to assess like if this is really what you want to do. Because I feel like if you do want to do this, no matter what, you're going to get to it.
No, exactly. And, don't fall into the same crowd who wants to become a doctor or who wants to do this or that, which is because that whole culture is going to change eventually, and you'll still be the boring person. You know what I mean? Like, again, yes, exactly. Right on point, that just reassess yourself, refocus, and you're like, hey, you know what? I think I really enjoy doing this. Maybe I should focus on this. Absolutely. And I'm still figuring it out. I mean, it's taking me time too. Like, I still feel like a lot to understand, and I still don't know I found internal peace in that sense that I'm doing what I like, but at the same time, it is a lot of work. So maybe one day I'll reach a point where like, okay, you know what? I think I'm okay, and I think I want to do these other things I want to do.
Yeah, for sure. I feel like it's a learning curve, like throughout your whole life. I really don't think that anyone's perfect, no matter what stage they're at right now. So it's really important not to compare to others.
Absolutely not. Absolutely not. You shouldn't, because you're gonna create extra stress for yourself for no reason.
Yeah, I think it's like also putting expectations on yourself, just so like you want to reach to a certain point, but then once you reach that certain point, you're always going to ask for more and just want to be better and do more and just want to keep pushing yourself. But then there's always a hard part of just trying to tell yourself like, oh, that's enough for me. But you're always going to have that battle between yourself saying that it's never going to be enough.
And it's never going to be. I'll tell you, I guarantee you that today, that anyone who's reached success, and I'm talking about people like Mark Zuckerberg or Jeff Bezos or whoever people idolize these days, they reached a point in their life and it's never enough. They want to go to Mars. Like, I swear, like, how much more success do you need? But it's never enough, because they keep putting those expectations on themselves and not really finding that internal peace. Like, hey, one life, I want to make the most out of it. Today is what matters. Tomorrow may not be there. sure, I need to plan for it, but I don't need to give my entire emotion, energy, and everything to just give into that and be done with it. You know what I mean? Like, just, we wait for those moments like, okay, I'm going to reach one day at this point, I'm going to be happy. Believe me, that moment never comes.
Yeah, no, thank you so much, Dr. Singla, for just like telling us the brutal truth and just speaking what's, like just telling us the truth about everything in terms of life and this whole medical career path. We really appreciate it.
No, you're very welcome. I think, I'm sorry ahead of time if it sounds a little preachy, but I think people need to kind of understand that every path is not the same, as you guys said, right? So very welcome anytime.
Yeah, no, thank you so much.
I feel like this was like the perfect mix of like proper advice, unconventional advice, which is a good thing, but also at the same time, it was very practical and motivating as well. So it was a perfect mix of all those things. So yeah, thank you so much for that.
No, you're very welcome. Happy to do this anytime.